So this is a little bit of a background to how we came to have the Health and Disability Commissioner Act 1994. So back in the mid-1980s, two women, Phillida Bunkle and Sandra Coney, published an article in the Metro magazine, and it was around what they said were unethical research practices being carried out at National Women's Hospital, which I'm not certain if we've got people from around the country, but that's in Auckland. And it was a hospital where women went for treatment and also had their babies. Some of you may have heard of this before. And so what happened was, as a result of that article, the government of the day decided to conduct a commission of inquiry into the research practices at National Women's Hospital. And so they appointed Dame Sylvia Cartwright, well, she's a dame now, Sylvia Cartwright, and so it became called the Cartwright Inquiry. And she completed her inquiry into the research practices at National Women's Hospital, and in 1988 she published her findings in a report. And what she found was that the women patients there were not told about their condition. They weren't given treatment options. They were discouraged from asking questions. They were entered into the research program without having been asked for consent, and they weren't treated respectfully. And quite a number of things occurred during the research program that were considered unethical. So as a result of her inquiry, the report made a number of recommendations, and that was to improve the power balance between doctors and patients. And these were extended into the Act to include all health and disability patients, providers and consumers. And the three key recommendations were for a commissioner to set up and oversee a legally enforceable code of rights, as well as to have a advocacy service to be on the side of consumers when they had complaints. And the third thing was to make sure that providers understood their duties. So the Act was written in 1994, but it actually wasn't fully enforced until 1996. And I don't know if any of you know, but many of the women in that research program actually died from cervical cancer as a result of not being given information about their health, not being given options. So it was really a very, actually the title of their Metro magazine article was called The Unfortunate Experiment, but I think it was much more than unfortunate. I think it was a very sad thing to have happened. So, as I said, the Health and Disability Commissioner Act 1994, that provides for a Health and Disability Commissioner, and the current Commissioner is Morag McDowell. It provides for a code of consumer rights, and there are 10 rights in the Code of Rights, and it provided for a nationwide health and disability consumer advocacy service. The purpose of the Act is to promote and protect the rights of consumers of health and disability services, and to facilitate a fair, simple, speedy and effective resolution of complaints. Because prior to the Act, there was no facility or no avenue for people to make complaints about their health service, their doctor, hospitals, or anything else. And so that was one of the main purposes of the Health and Disability Commission as a government entity, was really that there was a legal body to manage complaints about health and disability services. So a disability service is defined by HDC as a provider, any individual or organisation who puts themselves out there as providing disability services, and it includes goods, services, facilities to people with disabilities for their care and support, to promote their independence, or for related or incidental purposes. A health service provider includes all registered health professionals, doctors, nurses, dentists, etc. It also includes people who provide health services that might be considered outside the mainstream, such as naturopaths, homeopaths, acupuncturists, etc. So the Code of Health and Disability Services Consumers' Rights is about the consumers having rights and the providers having duties. But it's not actually about entitlement to or access to services or funding. And what that means is there are some things, some complaints that are outside our jurisdiction to support. We get many complaints from people who might say, look, I've been on the hip operation list now for over a year. I'm in really bad pain. I'm not getting anywhere. And, you know, can you help me? Unfortunately, access to services is one thing we can't support because it's outside of anybody else's ability to control, except for the providers of that service, hospitals, etc. And so we're unable to take complaints about access to services. Additionally, we can't take complaints that involve funding, access to funding, or if you had a complaint where you felt perhaps that you might want a refund for a service you don't feel you received. We get a lot of people who call and are very unhappy with a service that they've received, and they've talked about wanting compensation. Unfortunately, we can't support complaints about that. And so where we can support complaints is about the service that you've received in terms of maybe a consultation, the way you were treated by a service provider, a treatment that you had. So there are a number of things we can support, but unfortunately not access to services or money-related complaints. We do try and steer people where they might be able to go. For instance, if it was about compensation, we might potentially refer them to ACC if it may be an ACC matter. So we do try and steer people. And people who are wanting maybe a refund, we might steer them in the direction of the Disputes Tribunal, but I'll talk a bit more about that. So here is our Code of Health and Disability Services Consumers' Rights. There are 10. And what they said about this Code of Rights is that it was a no-nonsense, plain language set of rights, and really the sort of rights that would apply in our lives in lots of areas, at work, schools, anywhere you go. These are sort of fairly obvious sorts of rights, but I'll go through each one. So the first right you have is the right to respect. And what that means, it's fairly self-explanatory. We know how we feel when we're being respected, and we know how we feel when we're not being respected, but it's really that it includes your right to privacy. It includes your right to be provided with services that take into account your needs, your values, your beliefs, and that when people receive treatment, that can include even the receptionist at the medical centre that you go to. It includes all people that provide the service. So when you go to a service, it's that they speak to you in a respectful and appropriate manner. Your second right is the right to fair treatment. And what that means is that your right to freedom from discrimination, coercion, harassment, exploitation. It means that you get the same standard of care and the same treatment as everybody else, and that you are not made to feel that you are forced to do something that you don't want to do. So fair treatment, again, it's really self-explanatory. And the first three rights are very closely aligned. They kind of overlap. If you're being treated respectfully, you'll get fair treatment. And we move into the third right, which is dignity and independence. And dignity, having a service that treats you with dignity, is respecting you as a person. It is things like, for instance, if you were in a hospital, that, you know, a nurse didn't come and open your curtain while you're half unrobed. It is making sure that people respect that you have your own thoughts and beliefs. As I say, that's tied in with respect and fair treatment. So dignity is about that the service provided to you maintains your sense of dignity. And dignity and independence are joined together, because what they want is a service that promotes you being able to do as much for yourself as you can. And so depending on the service provided, if I think of, say, a rest home, it's making sure that the residents there can do as much for themselves. We had a complaint where a person who was capable of feeding themselves, but a care worker came along, must have been in a hurry or thought that the person was being too slow, took their fork and just started shoveling food into their mouth. Now, it wasn't necessary. The person could do it for themselves. So that wouldn't be maintaining their dignity and their independence.
Gabrielle, sorry to interrupt.
Yes.
We can't see the slides.
Oh, I'm so sorry. I don't know why. What is that?
I tried to do it a bit more discreetly. I'm so sorry. We are still at the first slide.
Oh, that's strange. I wonder why you're not seeing the slides. I'm so sorry, people.
No. You are extremely eloquent, and it's really, really easy to listen to you. And I got this thing here, and I'm actually following everything you say.
Well, look, let me just try that. I've never had that happen before where my slides haven't sort of been able to be seen. Just let me try that again. I'm so sorry, people. Yeah, can you see this screen now?
Yes,
yeah,
and that's the slide.
Thumbs up,
and now,
lovely.
And now,
okay, well, I'll just catch up to where I'm at. So I was just talking about, can you see that? The code of rights?
Yes, yes.
This is where I'm up to now.
Thank you so much.
Yeah, so we've talked about respect, fair treatment, dignity and independence. And now we're on to right 4, which is proper standards. So proper standards is about your right to have services provided with reasonable care and skill, and that the person delivering the service or providing the service has that care and skill. It is that every consumer has a right to have services that comply with legal, professional, ethical, and other relevant standards. It's that every consumer has the right to services that are provided in a manner consistent with his or with their needs. So depending on the individual and what your needs are. That every consumer has a right to have services provided in a manner that minimises potential harm and optimises the quality of life. And that every consumer has a right to the cooperation among providers to ensure quality and continuity of services. So that's quite a big right. And so we might get complaints to us that might be something about the skill or care that they received. It may be that something harmful occurred. So that would probably relate to the proper standards right. With effective communication, what we know is that communication is not just about someone giving you and telling you information, but it's also that they must also listen to what your needs are, what your views are, and that there is a two-way effective communication. And what we know too is that there are barriers to communication, and service providers need to be really aware of any barriers such as hearing or sight or other physical thing that may impact communication. It could be mental capacity, it could be language. So there are barriers, and providers need to communicate with consumers in a way that they understand. That is the important thing. So yeah, again, not just giving you and talking to you, but listening and communicating about the risks and benefits, what options are available, and other sorts of things as well. And full information, again, these two are tied quite closely together because full information requires effective communication. Full information is getting everything you need to know about what is going on for you and your health need or disability need, and not giving part of the information. So we've had a complaint where somebody felt that they weren't given the risks and benefits information about a procedure they had. And then they had an adverse reaction to the procedure. And so that person felt that they hadn't been informed that that was a possibility. And so, you know, it's for providers to really make sure that they give you all the information you need. And that's because you need effective communication, full information to then be able to give informed choice or informed consent. So that is right number 7. Informed choice, informed consent can't happen if you haven't been communicated with effectively and given all the information. If I said to you that, look, you have two potential options to treat your knee injury. You can have a knee reconstruction or you can have a knee replacement. Very different treatment options. And obviously there are pros and cons for that, and information about what's involved, what are they using, how does that work, what are my long-term outcomes going to be. So a person can't make a good decision about whether to go with one option versus another if they don't have everything they need to know about it. And I was reading recently on the HDC website, they post case studies. And so I was reading some of their case studies, and one was about a woman who felt that she had not had given informed consent to her GP for a procedure that she had. In fact, it wasn't even informed consent. She hadn't actually given consent, and the GP had done a procedure without actually asking her first. And you can understand that this informed consent directly relates back to the National Women's Cervical Cancer Research Program and the importance of people being informed and making informed choices. The 8th right on the Code of Rights is support. So you're entitled to have support when you go to the doctors, or if you're at hospital and you need a support person. So you have a right to support. Obviously, there will be times where that support may not be allowed to occur, and that would be for health or safety reasons, or if it may impinge on the privacy of another person. But generally you have the right to support. With Right 9, teaching and research, so again, this relates directly back to the National Women's Cervical Research Program. So teaching is when you go for a procedure or you go for a health service and they have someone who is training. You must be asked for consent for that person to be there, to participate in whatever is happening. You have to give consent for that. You should be informed, and you need to give consent for that teaching person to be there. I've been to hospital, and I can remember I had a consultant come to see me, and they had about 6 other registrars, I suppose, who were learning with them. And I didn't feel comfortable having all those people, sort of hovering around my little cubicle. And so I said, look, I'm not actually happy about all those people. I'm happy to talk to the consultant. He's the person I really want to hear from. And so I have a right to say no to that. And so do you. So do all consumers. They have a right to say no if they don't want someone who is training to participate. If you enter into any research programs, again, full information, effective communication and informed consent apply. Usually you would have to sign that you give informed consent. My husband was asked to be in a heart research program, and so I said, look, read very carefully all the information. And he discovered that if he was in that program and something went wrong, he wouldn't be covered by ACC. So he's immediately a bit concerned. And he talked to them and they said, yes, so that is right, but the people who are funding the research have an insurance policy that would pay the equivalent of ACC. So it's always good to read thoroughly and understand what you're signing, giving consent to. And of course, your last right 10, is the right to complain. And that is what the Act is all about. It's the HDC are a complaints resolution service. The Nationwide Health and Disability Advocacy Service that I work for are a complaint resolution service. And so you have a right to raise complaints about those things. So I hope I've talked through that okay. It's hard when I can't see anybody. Oh, I'm sorry, I've got a blank one. Let me move on. Oh, why am I getting blank ones? I'm sorry. Okay, so when a consumer complains to the Health and Disability Commissioner's office, the Commissioner has a range of options when they look at a complaint. They can refer it to the Advocacy Service for resolution. They can investigate the matter, and they can decide to take no further action. Generally, that would be if it wasn't within the realm of health and disability services, or they felt that it was an appropriate use of their sort of funding, or they may refer it to another statutory body like the Privacy Commissioner. So we get some complaints which relate to privacy. Some people may call us and say they're not happy about what's been recorded in their medical files, notes that have been taken. And so that information would be covered by the Privacy Commissioner. Other people feel their human rights have been impacted by the health service they've received. So the HDC may refer them to the Human Rights Commissioner. So it just depends. They have those 4 options. When they investigate a matter, they will look at it and give it a legal and a medical overview. They will decide if the Act has been breached or the Code of Rights has been breached. They may make recommendations to providers on what they need to do to make corrections. And in a small amount of cases, they may take legal action against a provider. So who provides the service I work for? The Nationwide Health and Disability Advocacy Service is part of the National Advocacy Trust. We're not for profit organisation, and we're contracted to do the advocacy by the Director of Advocacy from the Health and Disability Commissioner's Office. And so that is to meet the purpose of the Act, to provide advocacy for consumers. So we've got around 33 advocates all around the country, and we're all employees of the National Advocacy Trust. I don't know, I'm so sorry, I don't know. This is populating blank screens. This was not here prior to my coming on to the Zoom. I'm so sorry, I don't know what's happened there. So our advocacy service is free. We are an independent of all health providers, disability providers, the Commissioner's Office, the Ministry of Health. We're completely independent, and we're a confidential service. We don't discuss anything about consumers without consumers' permission. And that's important, that people feel free to really talk to us about what concerns they have. So the advocacy service, we work alongside consumers. We empower consumers to advocate on their own behalf. We call that self-advocacy. Some people feel really comfortable to self-advocate. They just need a bit of guidance about how to structure a complaint letter, and we can support them with that. Other people, for whatever reasons, feel that it's just too hard, they can't do that themselves, and so we're happy to do that and walk alongside them to raise their complaint, and we put that in a complaint letter on our letterhead, and then that goes to the provider, and we work with the consumer until we come to the outcome of the complaint. And an outcome will be it's either been resolved for the consumer or the consumer doesn't feel it's resolved. And I'll talk a bit more about that. But our focus is on trying to achieve resolution between the consumer and the provider. And we talk to consumers about what would you want to make you feel your complaint had been resolved? And that might cover things like an apology or acknowledgement something went wrong, or an explanation. It may be, a lot of people say to us, we just don't want the same experience for anybody else. So we might request that the provider looks at what steps they can take to improve their service for the consumers. So consumers can make complaints if they don't understand, things weren't explained, and don't feel they've been listened to, consent wasn't obtained, anything like that. It's absolutely fine to complain. And if you're not even sure if our advocacy service is the right service to support you, you can still call us if necessary. We can direct you to other services. So that's our free phone number, 0800 555 050, or you can email advocacy@advocacy.org.nz if you require an advocate. So we have an 0800 team. They will take the initial inquiry, and then generally they will send it to the advocate in the area that the consumer is in. But as I said earlier, we actually can and do manage complaints anywhere in the country. The only time it's not practical is if we were to attend a meeting, a resolution meeting with a consumer, you'd obviously want an advocate in the area that you are. But essentially, that's our overview and our introduction to the Code of Rights, HTC, and the Advocacy Service. So if anyone has any questions, I'm happy to answer them.
Thank you so much, Gabrielle. Yes, you can start asking questions now.
It's so funny when you can't see yourself delivering and you can't see people.
No. Okay. I think we've got okay.
No questions. Oh, that's easy.
we've got a lovely thank you.
Thank
Someone
you.
that's it's a consumer of the health services and said that I didn't know this existed.
Yeah, and you are seeing we've got a little bit of time. I just want to say, so I have 4 functions to my role. I get inquiries from our 0800 team. So I follow that up to learn about what people's concerns are, whether it's going to go to a complaint or whether it's something that I can support them to advocate on their own. So inquiries, then I deal with complaints, and currently I probably have about 30 on the go in different processes. And then the third thing I do is to do education sessions like this one tonight, where I talk to providers and community groups, consumer groups, and talk about the Code of Rights. For providers, we go further. We do sessions on complaint management. We do them on open disclosure. Open disclosure is when they have to disclose that something has gone wrong. And we do it on informed consent. So we do with providers somewhat more education sessions, but generally community groups, and that's to get the word out so that people know that our service is there, it's free. We want to be able to help and support people, many who feel in a very vulnerable situation and need that support. So yeah, it's a really great service, and I hope that now that you've had a little bit of a chat about it from me, that you reach out if you need any help to our 0800 team, and they'll send you to a lovely advocate in our service.
Okay, we've got another question. Just a second. That's really funny. I like complaining, as I know I have my voice. How do I start self-advocacy? Thank you.
Oh, fantastic. Well, feel free to call us, because what we do is we send out, when we get inquiries come through, we send you information about the advocacy service. We can send you, if you're keen on self-advocating, we can send you a information sheet about how to self-advocate. But we always encourage, because we think that people having their own power and complaining for themselves is really great. And so we always encourage people to, in the first instance, raise the complaint directly with the service provider. Do it in writing is best, although they should take your complaint even if it's verbal, and they should treat your complaint exactly the same way as if I was writing the complaint and sending it to them. So in your complaint, you want to focus on the summary of what's happened, the key issues for you, what's really important that you want them to understand, and then importantly, the resolution outcomes. What would it take for you to feel the complaint was resolved? Is that an apology, perhaps for being disrespected? Is it that they say that they'll provide more training to their staff because they needed something like that, and always ask for a response in writing from a provider. That's always good. So yeah, that's my sort of key thing. Go directly to the provider in writing, summary of what's happened, key issues, and what you would like to resolve the complaint.
Well, thank you very much. That's very helpful. We've got another question about the contact details in a savable format. Are we going to receive the slides from tonight? Can we share them with...
Look, I don't know that I'm allowed. I don't know that I'm allowed
okay.
to. The last page, I'll certainly send you with
the
just
last
the contact
page is
details.
great.
Happy to send you that with the contact details, and I'll put my own number there as well.
Okay.
For anyone, well, anybody can contact me directly, but I'll put my name and phone number on the bottom of that slide, and I'll send that to you.
Yes. Okay. And we're gonna circulate that, and I hope that helps.
Oh yeah.
We have, I just want to reassure everyone that the webinar is going to be recorded. It's going to be in our website, and you can always refer back to the recording, because people asked about that. Another very interesting question is, approximately how many consumers do you support annually?
Oh, do you know what? I knew you'd ask me that. Now, I am a relatively new, do you know what? I rang my manager just before I came onto this, and I said, look, I've been asked this one time. I don't know if it'll come up tonight, but how many consumers are, how many complaints are we taking in a year, and how many inquiries in a year? And of course she couldn't, because I was ringing her, it was just before 7 tonight. She didn't have the information at hand. She didn't want to give me the wrong one, but we get thousands of inquiries. Now I'm assuming we're talking 10,000 inquiries a year. Complaints, I'd be hazarding a guess, but I would think we'd be getting somewhere in the vicinity of about easily 3,000, 3,000 or so complaints a year. But don't quote me on that, because I am just sort of trying to conjure them from my head. But it's a lot, it's thousands. We're helping thousands of consumers a year. And
that's
either through if you add up both complaints and inquiries, it's a lot.
Another anonymous comment, and I think it's very, very timing. It says, perfect timing for me. I do have 3 serious complaints where I need help. This webinar is eye-opening. Thank you so much, Gabrielle.
Oh, thank you. That's great. That's great.
And another compliment that says, I feel very supported by MS Auckland. Thank you. I know who you are.
Oh, that's great. That's really good.
Thank you so much. It's really lovely.
Yeah.
So we're gonna circulate your details, Gabrielle, with your permission to attendees, and we probably gonna promote them a bit, more than just to people that were able to attend live tonight.
Yes. I mean, please, put the word out there. I'm happy to talk to any other groups that you're associated with,
And it looks like we're gonna have you back. Do need support, and there's lots of instances when you don't feel that you've been heard, or you've been your opinion counts, or your respect.
Yes.
And it's really, really hard, because as a consumer you're already on a vulnerable position, I'd say. And knowing that people like you exist, gives us all a little bit, of more.
And it can be hard if you've got challenges. It can be hard, to get the energy and the courage to sort of make a complaint. And so, someone walking alongside that process. We can't influence or compel providers to give you a good response, or, but our role is really just to walk alongside you, to at least put your word out there to the provider in the hope that it will result in improvements in service. That is the main point of making a complaint, is to improve service.
We just received another very interesting comment, and it's more clinical than just advocacy, what you've mentioned before. It's that about your service, that would be great for people who aren't taken seriously with their symptoms. Some take so long to be diagnosed. Would that be something that you could possibly support someone with, or?
I don't want to speak inappropriately, because you are a group of MS, but I went on to HDC's website, and as I say, they have case studies, and there was a case study about a young woman, I think, who was concerned about the delay in her MS diagnosis. And so it was quite interesting to read the actions of HDC around that. And that might be something that people might like to go and just have a look at on the HDC website under case studies. And if you search multiple sclerosis, I think it brought up some related and some unrelated. But I thought that was very interesting. And so it's difficult. It's a difficult complaint, and you know, sometimes we feel that the complaints really aren't going to be resolved through the advocacy. In those cases, we support people and refer them to HDC. But HDC actually have unprecedented influx of complaints over this last year, and you know, they're really a bit under the pressure, as everybody is, but you know, that is an option too. People can take a complaint directly to HDC.
And I just want to tell people that you can find this. I know it's the other way around, but I bet you've seen those everywhere, in the GP's waiting room and at hospitals everywhere. We've got quite a few, probably a few hundreds at the office that we always have in the cars and hand them to people when we do home visits. And yeah, all the websites and phone numbers, HDC's website, and they all at the back if people want to do some extra research.
Yeah. Also, in all the hospitals, doctors' rooms, all those places have those big red posters with the Code of Rights on them. You may have just seen them so many times they've become invisible, but they're big red posters. They have the Code of Rights, and at the bottom they've got HDC's 0800 number and the Advocacy Service 0800 number on those too.
Yeah. And there's another question, and it seems quite complex. If Privacy Act 1994 is breached by government entities, what the advocacy can do? Can they press charges for compensation?
So if it's to do with privacy, that would be under the auspices of the Privacy Commissioner's Office. And so I would imagine that if there's been a breach of privacy, you would have to go there. We wouldn't be able to, because that we consider that outside of our jurisdiction, because privacy is not, even though, you know, I did talk about privacy, that you have a right to respect, and so people need to respect your privacy. That is, they shouldn't read, you know, if they go into your cubicle or room, they shouldn't read your mail or look through your drawers or that sort of thing, or tell other people your information. And we can, if it's a health provider, potentially we can do a complaint there about a breach of privacy if it's from a health provider, but if it's another Crown entity, we probably can't. Okay. I don't know if that answers sufficiently. But.
Yeah, no, it does. It does. Yeah, thank you for that. And yeah, another comment. It's really nice. It says, thank you, Gabrielle. People with MS can get tired easily, verbally, mentally, physically. I will contact you, Gabrielle. Hope you don't mind.
Of course not.
So, and there's quite a few people, quite a few comments here, you know, people saying that they're going to be in touch because, yeah.
Oh, lovely.
Yeah. So this is the end of the questions and the end of the presentation tonight. Gabrielle, thank you so much. It was so informative and so good. And
it's really about the little funny things like blank pages. I don't know where those blank slides came from. Oh, well, never mind. Technical issues.
It makes it unforgettable, you know, because otherwise it would have been just another Tuesday night, but it's not.
Yeah, true. Oh, thank you, Anita.
Thank you so much. And
thank you, everybody.
We will circulate your contact details. Hope you don't mind. And
of course not.
You're gonna advocate and you're gonna support our community.
Yes,
because
absolutely.
That's why
that's what we're here for.
Yes. Thank you so much. Thank you.
All right. Good night, everybody.
Good night, and we'll see you next time.
Yes. Thank you.
Bye-bye.
Bye.